And the pelvic floor, they've done so EMG, so they've put needles in people's muscles to see when they activate, and they had them watch suspenseful movies. So we know that our pelvic floor actually engages in time of like stress and anxiety. And
Mm-hmm.
this correlates so much, this brings it back to that whole nervous system perspective that I know you talk about so much as well. And so if our nervous system is just on and we're in that fight or flight mode, that pelvic floor is just in,
Yeah.
yeah. So we've got muscle tightness, we have pain, you might have constipation. Um,
Yes.
you're going to have that reduced blood flow. And then take that a step further. So now you've got the stress and you have that local pelvic floor response, but it's also actually going to mess with your hormone production.
Yeah.
So it's gonna downregulate your GnRH, your gonadotropin releasing hormone. Big word, but it's kind of like a master hormone that your brain produces, and that's what tells your body to produce some of the sex hormones that are important for conception. But in
Mm-hmm.
times of stress, our body actually produces less of that hormone, and it just slows everything down. And so your system is not going to be in a good position to conceive. And so, yeah, very
Yeah.
nervous system health is, I think, one of the most overlooked things when trying to conceive. And then digestion too. So like that's
Mm.
huge because number one, so food can be a source of inflammation in our system. And so if we're noticing, especially more in like thyroid panels, so if I notice somebody is making antibodies, so that's when we're making cells that attack our own body, usually that system will ramp up and worsen under times of high inflammation. So
Mm-hmm.
what we want to do if we're seeing that is we want to look at what are all the sources of inflammation in your system and in your life, and what can we do to modify those? So food can become, pretty significant for people. It can be a very significant source of systemic inflammation.
Yeah.
Also, people can develop a leaky gut. So that means there's just some of that cellular integrity. So if our gut's supposed to be nice and together, it kind of starts to spread apart, and particles of food can go through, and that can create a lot of inflammation and symptoms in our system. And so digestive issues really are just kind of another little like, hey, flag over here, like something's awry. We need to kind of dig deeper into that. There's even connections between H. pylori and sperm and egg quality.
Oh, okay.
So really, now, is that going to be for everybody? No, not necessarily, but it definitely should be kind of on the list of things. And if we're checking off these like bigger, giraffes in the room, that might
Yeah.
be our zebra that we need to think about that's in the background. So, nervous system health, we know, yeah, we have talked about that. So
Yes.
that's going to impact your hormones. We really want to, so that fight or flight can be elevated and our anxiety can be elevated. It's going to then impact our sleep. It's going to impact our digestion. And so really being able to engage that parasympathetic or that kind of rest and digest and safe mode is
Mm-hmm.
really very important. So a lot of things. So if we have had trauma in the past, and that can be, physical trauma, emotional trauma,
Mm-hmm.
it could be, you know, a lot. Yeah, it doesn't have to be this like big, massive like accident to be considered a trauma. And that can also actually be a source of restriction in our tissue and our organs. And sometimes we'll see, I know we talked about fight or flight for sympathetic, but also freeze can be in there.
Mm-hmm.
And so we can find that sometimes even within our system and within our organs or our nerves, that they're just kind of stuck. They're just
Mm-hmm.
frozen. And so we just want to start to get some gentle movement back into that system. But doing so, we're never going to be forceful with it, because that's
Mm-hmm.
exactly, what happened with the trauma is it was somewhat forced
Yeah.
on you. And so we really just want the system to calm and give it that safety and just kind of a gentle nudge and reminder of like how it should be working and allow the body to kind of reset itself over time. So really, we work with a lot of people that are undergoing IUI and IVF cycles. Generally, they don't find us until it's after like a failed cycle or two failed cycles, and then they're ready to like think like, okay, this obviously isn't working. I need to like figure out something else that's going to help get us to where we
Mm,
need to go. Sadly, it's not their doctors that are suggesting something else. It's just
right.
them like researching on their own. And so what we really want to do for couples that are doing IVF and IUI is we absolutely want to make sure that their egg and sperm quality is good, and for women that your uterine positioning and mobility especially are good as well, because that's going to be helpful for implantation purposes. And then
Yeah.
ovary health too, so if they're having difficulty kind of like with the egg retrieval process, we want to make sure kind of ovaries are in a good position and also have really good mobility. So it takes about 70, so sperm regenerates about every 74 days. Egg egg quality can be improved after about 90 days. So I always tell people for that are in these situations, it's always, always, always my preference to see you about 3 months before you are planning to do an egg
Okay.
retrieval and starting that process, because that's really the time that we need to make those dietary changes, those lifestyle changes. If we're going to do any supplements, we really want all of those on board and consistently done for 3 months to
Mm,
ensure that we're actually impacting that egg and sperm quality. That's something else I see too. Like some people will be like, oh, well, I tried like such and such for a month and I didn't get pregnant. That's really not enough time. Like we
mm,
really need to be giving our interventions 3 months.
okay.
And the same vice versa. Some people will equate like, oh, I started X, Y, and Z last month, and then this month I got pregnant. So it must have been
Mm,
that.
yeah.
L Likely not,
Yeah.
but because again, it would really take, a couple of months
One.
of consistently addressing these things that we find, these root causes, in order to really see a shift in somebody's fertility and health status too in general. Like, yeah, there's no true quick fix.